Hi, good morning. This is Joganpreet Kaur. My student ID is 119831220. I'm going to do the wound dressing procedure. Before that, I'm going to rotate my phone 360 degree to show the room. Now I'm going to start the procedure. Before that, I am doing my hand hygiene. Now I'm going to the patient. Hi, good morning. This is Joganpreet Kaur, your student nurse today. I'm here to perform the wound dressing as I have my prescriber's order. Is that okay with you?
Yes.
Could you please tell me your name?
Seneca College.
Date of birth?
17 November 1999.
Okay. Can I see your wristband? Perfect. It matches with my records. So, Miss Mehak Kaur, do you feel any kind of pain?
No.
If I'm giving you pain rating scale where 0 is the lowest and 10 is the maximum, could you please describe if you have? Okay, so my patient is having no pain. She marks 0 on the rating scale. So do you need any kind of medication?
No.
So she don't need any kind of medication for the pain. So do you have any kind of allergy from food or
No.
any drug? So my patient is having no kind of allergy from any food or drug. So now I'm going to elevate the bed, reposition the bed to my height so it won't hurt my back. Now I'm going to reposition my client. Could you please turn towards my side a little bit? Perfect. So if the wound is on the abdominal area, chest area or the back area, we are going to move the client towards our side to prevent any kind of soilage. But my client has the wound on the lower forearm, so I'm just asking her to move little bit towards me. So now after the repositioning of bed and client, I'm going to open the tray. Before that, I'm going to do the hand hygiene and provide the privacy to my patient. So now I'm going to open the tray, first far away from me, the sides, and now I'm going to reposition my tray from diamond shape to square shape. I'm going to reposition my dressing tray, and I'm also maintaining 1-inch border. So I manipulate my tray from diamond to square shape, also maintaining the 1-inch border, and I'm also maintaining the sterile triangle area. Here is my dressing table, here is the garbage bag, and she is my patient. Now I'm going to add more supplies. First of all, this is the normal saline. I'm going to add the normal saline in this corner where there are some gauze pieces, to dip some gauze pieces, and I'm going to add more gauze pieces in this to by banana peeling method, and discard this. I'm going to add the Q-tip and discard this. So now I'm all ready with my tray and I'm ready to assess the wound. So before that, I am doing hand hygiene and wear the gloves to assess the wound and the previous dressing. So as evident from the dressing, there is no active bleeding, no pus, but there is small amount of serous sanguineous drainage is present. So I'm going to discard this dressing and going to assess the wound. So the location of the wound is the lower forearm. Now I'm going to assess the length of the wound with the help of Q-tip. I'm measuring the length on my measuring tape. So it's 5 centimeter in length. And as from the observation, the wound is well approximated, closed with sutures. There is no edema. I'm going to palpate. Do you feel any kind of pain while palpating?
No.
So there is no pain while palpating, but there is mild erythema present. So location is lower forearm, length is 5 centimeter, wound is well approximated, closed with sutures, no edema, no pain, but there is mild erythema. Now I'm going to do the dressing. Before that, I am removing my old gloves, doing hand hygiene, and wearing my new gloves. Now I'm going to make the dumplings with the help of forceps. So first of all, I'm using this soaked gauze pad to make the dumplings and squeeze little bit water from them. Again squeeze to remove excess water, and first of all I'm going to clean head to toe the farthest side from me, least contaminated to more contaminated, and going to discard that. Now again using this second soaked with excess water. Soak the excess water. Now I'm going to do the closest side to me, head to toe, least to more contaminated area. Now the first. Soak excess water, and the third one is the midline. Now I will follow the same directions while pat dry the wound. So I'm going to take one gauze piece, make dumpling, and going to pat dry again the farthest side from me, head to toe. The second one, the closest side to me, and now the third one is the midline. Now the wound is clean, so I'm going to put the gauze pieces. So I'm using this 4x4 gauze piece to secure my wound, as this is the closed wound and there is no active bleeding, so I'm not going to use the thick padding or abdominal pad. I use another gauze piece to secure the wound properly. And now I'm going to use the tapes to secure my wound. Along every side. And this last tape is the identification tag, where I sign my name, initials, date and timing of the wound dressing. So this is all about the dressing. Now I'm going to ask the patient, do you feel comfortable now?
Yes.
Do you feel any kind of pain?
No.
So my patient is comfortable, well tolerated, she feels no pain. Now I'm going to reposition the bed and patient also. So I'm going to lower the bed to the lowest position and ask the patient to move to the original position. And this is your call bell. If you need any kind of help, just call me. I am the outside. Okay, so this is all about the procedure. After that I will document all the recordings about the wound dressing. And now I'm going to do again 360-degree rotation of the room, and I'm going to discard my gloves before that, and 360-degree rotation of the room. That's it. Thank you so much.